It was time for my 20-week routine ultrasound. It was a pregnancy at that point like any other, until that day when our world flipped upside down. So I was alone in the room. She comes in, she hands me a box of tissues first. She goes, all right, so there was some big abnormalities with the ultrasound. She didn't say at that point spina bifida. She said, we're seeing hydrocephalus.
And then I just got a call from Katie, just sobbing, saying, something's wrong.
We went to see a specialist, and what we thought was hydrocephalus was actually much worse. It was myelomeningocele spina bifida.
Myelomeningocele, the sort of central problem is the spinal cord doesn't close. And so babies with myelomeningocele, the spinal cord is actually exposed to the outside world. It's kind of connected right to the skin, and you can see it right on their back.
Here we see the most complex and the most severe cases and have that experience. So you need to really have the depth of experience, the depth of a team to get the best outcomes you can.
Everyone leading up to children's gave us the perception of not much hope.
So then in that, one of the bits of information that they gave us in this packet was this idea of fetal surgery. I just remember walking in and there were all these people that are just so specialized in their fields. They're experts in it, and they're all sitting here talking to us about how we can give our child the best chance of life.
Once the patient shows up to our center, we have a staff that welcomes them. We have coordinators that are present to guide them and navigate them, really like a concierge service through the various meetings and imaging studies that they're going to undergo.
They have the MRI first. Then in the same building, they just go 4 flights up stairs and they have the ultrasound and the ultrasound of the heart of a baby as well. Soon after they are done with the test, all the doctors that look at those tests and saw the patient, we get together, we discuss what's going on, and then we bring the parents into the room and we show them the images. In the room, it's not just the radiologist, but also all the different doctors who have an input in what's going on. So we try to counsel the families with all the information available to us to provide them with a good idea of what's going on and what's to come. So they are prepared not only for the delivery, but also the rest of a baby's life and their own life.
Spina bifida is a hard condition because they call it kind of like the snowflake condition, because you really don't know. It's sort of a wait and see. But what they could see was from the MRI, they could see the hydrocephalus and the fluid on the brain and the Chiari-2 malformation and what that could mean. And they explained that to us. And a lot of it came down to he may need a shunt. If it's at birth, this is when we're gonna do it.
In Katie's case, when she was pregnant, based on the imaging findings of ultrasound, MRI, etc., she was able to qualify for the surgery.
Traditionally, for decades and decades, we've been doing an operation to close the spinal cord, get skin covered over it within a day or two after babies were born. About 10 years ago or so, a randomized trial was able to show that we can actually do fetal surgery and close that sooner, and that decreases a lot of the long-term effects or a lot of the secondary effects that happen. When families are referred to Children's Colorado and thinking about the option of prenatal surgery, we have a very precise protocol of how we go about that.
One of the issues with myelomeningocele is that it's a defect of the lower spine, and it impacts all the nerves from that level of the defect on down. But it also allows leakage of cerebral spinal fluid out of the spine, and that creates problems upstream within the central nervous system or within the brain. 80% of these babies end up receiving what's called a ventriculoperitoneal shunt, where they put a little tube into the ventricle. It's tunneled underneath the skin into the peritoneal cavity, into the abdomen of the fetus. And that is one of the issues that is significantly reduced by the fetal surgery. It cuts that rate from 80% if you don't have fetal surgery down to 40%.
So Liam had an MMC repair in utero where they went in and repaired his spine. And that's where they exposed Liam's back to the world and repaired his spine. Us Spina Bifida moms like to call that his first butt day. It's actually celebrated. And from there, they just repaired his spine and closed me back up. And I was on a really strict bed rest for the rest of my pregnancy.
A fetal repair of myelomeningocele is one of the newest surgeries that we do in neurosurgery. It's definitely one of the most complex, and it draws on a lot of expertise that doesn't normally overlap. You know, we have fetal cardiologists and maternal fetal medicine doctors, anesthesiologists, neurosurgeons, all working together to take care of two patients at once, which is also one of the unique aspects. We typically have two anesthesia teams, one to pay attention to mom's vital signs and mom's needs, and the other to pay attention to the fetus.
At 33 weeks, Liam decided that it was his day, and he was born at midnight. Two nurses that have spent a lot of time with me were on shift that night, and I was thankful to have them by my side. And I was really nervous because I thought the C-section would be a breeze as far as like my nerves go, because I've already had fetal surgery. But I was so nervous because it was really like me seeing Liam.
This model of having this type of center in a children's hospital ensures that mom at delivery is not separated from her child. At the same time, has access to pediatric subspecialty. You know, if she had delivered in an adult hospital, it might be an adult surgeon looking at whether to shunt or not, or they might have to bring a pediatric neurosurgeon over. By having the delivery occur in a children's hospital, mom's literally down the hallway from where their baby is being taken care of in the newborn ICU, and ultimately getting their surgery and not being separated. I can't overstate how preventing that type of separation, decreasing stress for family and improving family-centered care, that's what a fetal center does.
The number one reason you do fetal surgery is to greatly reduce the chances of him having to have a shunt. So the following morning, the neurosurgeon came in and, discussed everything. And he's like, yeah, no, everything's looking great. Like we're gonna obviously continue to monitor. But he's like, yeah, there's absolutely no need for us to remotely rush in and do anything at this point.
I mean, the biggest benefit to Liam, is that he doesn't have a shunt, and he's, several years old now.
Myelomeningocele can really have a range of severities, and each kid is unique. Not all of them need everything, but some of them have weakness in their legs and need braces, some need wheelchairs. Almost all have problems with bowel and bladder function and need care from the urologists. Almost all of them need physical therapy and neurosurgical care. And here at Children's Colorado, we have a spinal defects clinic where all those different subspecialties are in the same place at the same time. They can see everybody in the same day, and then we all talk with each other and coordinate care.
Children's is just everything to us. I mean, it's completely shifted our journey, our perspective, and they're still there for us, and they always will be.
The more you do something, the better you are at it. If you're doing infrequently, you're not innovating, you're just trying to recreate what you did before.
Research in pediatric care and in myelomeningocele has made a tremendous difference. It's a very different disease than it was decades ago. The care is much better, and life expectancies are starting to show that great improvement in care.
Good job. I thought that our idea of the things we could do would not be an option anymore, and that couldn't be further from the truth.
There are certainly challenges with it. It's not like there aren't, but like life has challenges. He's such a joy that it's like I can't imagine life without him.
Yeah. We do everything. We hike, we rock climb. Liam rock climbs. We swim, he rides horses. Life's beautiful on this side, and there's so much hope, and there's challenges. There's some days that are really difficult, but it's so beautiful. And I wouldn't trade our story for anything. It's given us a total different perspective on life. It's a beautiful life.
If you or your family are facing an MMC diagnosis, or if you would like a second opinion about your diagnosis, the Colorado Fetal Care Center is here for you. Please contact us to discuss our processes and procedures, outcomes, and research and innovations as you determine what is best for you and your child.